Right, karibu sana. This is Morning Cafe. I'm yours truly, Stanley Nyorengita. It's a Monday around 9 a.m. giving you some tips on matters first aid as we do every single Monday to the whole tail end of this show. And this morning we discuss matters, pediatric first aid. And so in case you're a parent, you're a guardian, ama umeambiwa na mzazi, nichungie mtoto leo. And in case tu makosa ifanyike, an accident happens and you're wondering, how do I even give first aid to this child? That's our question of the day to you parents, guardians. What do you do when it comes to matters first aid? In case you want tips, call in live. In case you have your own tips, by the way, you can also call in live 0795 045 864 and you tell us all that. But then giving us all those tips is Andrew Wanjohi, first aid trainer. All the way from St. John Ambulance.
Thank you very much, Stan.
Tunasemanga St. John's lakini kwa St. John.
Ni St. John Ambulance, hakuna S hapo mwisho.
Karibu manze. Nachikia hapa hivi kwa flow meka dummies za watu wawili. Naona think moja tutamuita Jonte. Mwenye amevaa St. John Ambulance.
Mwingine tumeita Brayo.
Gender equality.
Muita
Ashley. Sawa. Naona Jonte at least kuna miaka kama 3-4 years.
Wacha tuseme 6 years.
6 years. Sawa. Ashley, how old maybe?
9 months.
9 months.
Yes.
So there's a reason kontaka kujua the whole age difference.
Yes.
And because later on tutakuna tuambia.
What are the differences between first aid ya huyu na huyu mwingine?
Oh yes.
Ndio.
Oh yes.
Yes.
Pia hapa chini there are other things zenye umetuletea.
Those are just items that are part of your first aid kit, dressings, bandages, gloves, and then sasa first aid kit yenyewe in different sizes. Kuna ile yenye unaweza kuwa nayo kwa hao, and then there is a larger one yenye kama kuna familia kubwa unajua kuna wale watu wanakuwa na watu 15.
Oh yes manze.
So tuna advise ukuwe nayo kubwa. And also for the workplace and such.
So typically kwa keja tu lazima kunafaa kuna ka toolbox tu ka first aid kit.
Usiite toolbox, ite
first aid kit. Makosa ni unajua ukizoea kuendesha gari. Ukizoea kuendesha gari. Anyway, so at least uko na first aid kit. But then not all families don't really have a first aid kit. Kuna wale first aid kit haipatikana, an accident has happened.
Maybe I could ask you. What do you think is in a first aid kit?
What do I think is in a first aid kit? I'd say, let me see, the whole bandages, obviously.
Yes.
Elastoplast is the same na bandage. Ni tofauti.
Ni dressing.
The whole
just
dressing.
a type of bandage or dressing.
Okay.
Yes.
What else? Scissors has to be there in case.
You have scissors.
Let me see.
You have spirits.
Oh yeah, true.
You have water. You have
painkiller lazima ku. Let's say
painkiller is not part of your first aid kit kwa sababu painkiller ni dawa. As a first aider, we don't advocate for you to dish out medication. Wacha hiyo ikwe kazi. It be a personal initiative. Ama uende kwa daktari akupatie dawa. But as a first aider, in terms of a first aid kit, you're not expected to have medication in it.
So ukiwa na hizo basics, cause ni basics zinazopatikana kwa nyumba ziko.
You have a first aid. Kama wewe unaweza kuuliza, kuna maji kwa nyumba, kuna chumvi, you can make salt water or saline water to clean wounds. Uko na spirit ama vodka. Hiyo inaweza saidia pia ku clean wounds. You have handkerchiefs or pieces of cloth. Hiyo inasaidia kama bandage. You have you have even sellotape you can use to put dressings in place and such things.
Right.
So a first aid kit is basically items that you may have. Ni vile tu unaniambia kwa hao haziko mahali pamoja. Haziko mahali pamoja, but uko nazo. Uko na makasi, uko na wembe, uko na all those things. So a first aid kit is just something that you need to put aside so that in case of an emergency, you're able to get all these things in one place. If someone has a burn, if someone has a wound, you can get all these things in one place and use them.
And love the fact that you were someone, because now for this one, a child.
Yes.
Someone who's below 18 years, someone who's dependent on parent na guardian.
Yes.
Typically, hata mimi nilikuwa pale na pika ugali nini vizuri, alafu makosa ikafanyika nikajichoma. Ama nikakata, ilikuwa nakata vitunguu nikajikata kidole. For me as an adult, najua venye nitajifanya first aid haraka.
Utafanyaje? Utaweka kwa mdomo.
Zizi nitapitisha kwa maji haraka, clean water and everything.
Yes,
it's okay.
Nice. Yes.
Medium sharp. But then now, for a child, let's say this is a good example. Jonte hapa,
yes,
is 6 years old. First off, ameumia. And I'll give an hypothetical of Jonte was playing with maybe a sharp object, and then he cut himself.
Yes.
So the response, your adult and a child, is quite different. What's the first thing, kama parent ama guardian, you should even think about your time? Umona ndule Jonte amejiumiza na kisu, and it actually looks like a very deep, cut.
Yes.
What's the first thing unafikiria?
The first thing you're supposed to think about as the person taking care of that child is the safety. No further injury for that child. So ile kitu amejikata nayo ni kisu, itoe hapo. Anything that has caused harm, kama ameshika kitu moto, remove them from that environment so that no further harm, because they've already been injured. So kwanza mtoe hapo. Kisha mtoa hapo, if they are bleeding, your number one priority is to stop bleeding. If it is blood needs to stay inside the body. So stop the bleeding and then cover the wound. Cover the wound with a dressing or a bandage or whatever piece of cloth that you have that is clean. If it is a minor wound, you can always clean it up first. You have time to clean it. We clean with water. Vile tu umesema. You clean with water. If not, if you're able to, you can use salt water. Ndio unasikia watu wanaekaga chumvi kwa nini? Kwa kidonda tina stop bleeding. It's just to clean it basically. So saline water helps to clean the wound. Alcohol swabs and such, they help to clean the wound. The point is to prevent infection. Once you do all that, if they need hospitalization, take them to hospital. Now wewe ndo determine how much blood have they lost. If you feel that it's too much, they need to go to hospital. Na uta-observe tu, utaona, hey, this is a lot of bleeding. Let me take them to hospital. And just for safety purposes, if you're not so sure, then just take them.
Mpeleke to
hospital.
So in any case here, the parent and the guardian, reaction yake, what they do. Yes. But then, Jonte is maybe 6 years. Mtoko 6 years ako amefika grade what?
Grade 2. Grade 2 ama grade 1?
Grade 2. Let's say for example wanatuwatch na pia nataka kujua na sasa yeye mwenyewe akijiumiza.
Yes.
What's the first reaction that they would do?
As the child.
As a child.
As the child, the first reaction would be to stop the bleeding if they are able to. Or to get away from whatever it is that has caused harm to them. And that's just reflex. It happened to hivyo. Atatoka, ataanza kulia. And crying is a good thing that then you know that they have been injured. So, but when they're quiet, then you're worried. But if they're crying, then ameumia wapi. So for the child themselves, what they need to do is just get away from whatever it is that has caused harm to them. Once they have done that, and now they have grabbed the attention of their caretaker, it is always important. Just crying out, saidia, help! Nimeumia, ama anze tu kulia. That is enough to grab the attention of their caretaker na akuje fanya msaidia sasa sort out their problem. Yes.
Nikianza niko nimependa hypothetically Jonte amejikata with something sharp.
Yes.
But then, and mostly even for young children, there's so many types of accidents that really happen for them. Tuambie, a number of them zenye ziko.
Most of the time, vile tu nasema, when they're playing, they get cuts and bruises, grazes. They also fall and break bones, have fractures and such. Burns, mtu anaweza mwagikiwa na maji moto kwa nyumba, ama ashike a hot plate, something. That can cause them to have a burn. Other now medical conditions that they may have are breathing problems that come from things like asthma, that come from things like allergic reactions. Those are now some of the common features for children that you may encounter. Those are the most common ones that you may encounter, and so hizo ndo tuna encourage watu kujua. And of course choking. Choking, especially for the very young, our infants, between 1 and 2 years. Choking is a common thing, and it is important that caregivers, people who take care of parents, guardians, teachers, they know that choking is a life-threatening problem that they need to be able to handle.
Right.
Yes.
Now that we've listed them, tracing into demonstrations.
Yes.
So when tutatuambia tunaanza na Ashley ama Jonte, na Sami ndio assistant wako hapa.
Wacha tuanze na Ashley.
Tuanze na Ashley, okay.
Wacha tuanze na Ashley because he is the youngest.
Okay.
And the highest priority in terms of age.
Right.
So the first thing maybe we need to understand is process your first aid is the same whatever the age. There is a primary assessment of your casualty and then a secondary assessment of your casualty, or primary survey or secondary survey. The primary survey is to eliminate any life-threatening problems, and it has 5 key areas: D, R, A, B, C. Dr. A, B, C. D is for danger. Is there any danger around them? Ndio kitu nilikuwa nakwambia, kitu ya kwanza unaangalia, unamtoa from that unsafe environment.
Right.
So is there any danger? Is the casualty responding? The response is, for such a young baby, they won't be able to talk to you. Hata kuambia mimi nakusikia. So if they are crying, they are responding. If they are moving, they are responding. Sasa. If not, then they probably are unresponsive. So A is for airway, B is for breathing, and C is for circulation. A is make sure that the airway is clear. I will show you just now.
Okay.
And then breathing, make sure that they are still breathing. And then circulation, make sure that the heart is pumping blood around the body. So when we start with this, tutakuja hapa hivi. Ama wewe ndo utanifanyia, nataka wewe unifanyie, si ndio? Na utafanya tu after mimi.
Okay, so.
So what you're going to do, you just kneel beside your casualty.
Okay.
Alafu utamuita. So you've gotten them, maybe if there's anything dangerous unamtoa hapo, si ndio? Then you check their response. How you check the response for such a young baby is by tapping their feet or flicking their feet. Chocho, unanisikia? So if they do not respond, then you know they are unresponsive. Kama uko peke yako, try and shout for help. Mtu anisaidie. And then we go to A. So tushafanya D, R, sasa tuko kwa A.
So what ni nini inaweza lead to mtu huyu asikusikia?
If probably they have stopped breathing. That is a common thing. If they're choking, that is also a common aspect that they can cause them to stop breathing. So they won't react. So what you're doing here, when you're checking for response, you're looking for movement. If there's any movement, you're sawa, they are responding.
Okay.
So you open the airway. How we open the airway is by tilting the head back and lifting the chin. And then you check for breathing. So you do that for up to 10 seconds. If the baby is breathing, then we're good.
So
that's a good sign.
10 seconds of...
what you're looking for, you're looking for any sign of chest movement, breath sounds, and any warmth coming from the baby.
So basically 10 seconds of... So doing this... 10 seconds of
listening.
This? Okay.
Try and listen. Try and look at the rise and fall of the chest and feel for any warm air coming from the casualties, nose and mouth. Yes. Fanya hivyo.
Kwanza gloves zinaingilia wapi?
Gloves zinaingilia. Unajua uzuri ni when you're taking care of a child at home, most of the time ni relative. So gloves at this moment, they may not be that necessary, but it's always a good idea to put on gloves.
All right.
So, but we'll put on gloves, don't worry.
Okay, so.
So.
Ntacha, let me observe so that I, with the viewers, to observe what you're doing.
Yes.
Then now, tuone kama tunaweza.
Sawa. So, I'll start with CPR. Then we go to choking.
Okay.
And then we can go now to bleeding and such.
All right.
So, you asked me about gloves. Let me put on my gloves.
Kumbe value wangu ile
kienyeji.
Ile kienyeji of
usually you hold it hapa hivi kwa wrist, unaikunja, then you put the thumb in first, and then hizi zinakuja tu zinaingia haraka like that.
Haya.
Sawa.
So mtu amesikia ukisema CPR anashangaa CPR ni nini? Even as you...
Yes. CPR is what you do for a baby who is not breathing. The moment you've checked for breathing, tumefika hapo kwa breathing. I've checked for breathing, and you cannot see any sign of them breathing. So they need to go to hospital. The first thing you need to summon an ambulance or organize for transport to hospital. And then start chest compressions. So CPR in full is cardiopulmonary resuscitation. Meaning you're doing the work of the heart and the lungs for the baby because it's not working for them. So that's what we want to do. Hello, Toto, can you hear me? Can you hear me? Someone help. In the airway, check for breathing. So the baby is not breathing. If I have someone I can send, I tell them, please go call an ambulance. Tell them I have an 8-month-old baby. They're not breathing. And then I'm going to start by giving them rescue breaths. I'm going to give 5 rescue breaths at the first point, and then 30 chest compressions, and then 2, and then 30, and then 2. That's how. 1, 2, 3, 4, 5. Every time you give a breath, you need to see chest rise. Because they are a dummy, they won't on a chest rise. But every time you blow into an actual baby, you should be able to see chest rise. That means that the breath is effective. So I'm giving them 5 rescue breaths. And then using 2 fingers, because of the age, we're going to use 2 fingers. Locate the center of the chest, and then do 30 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. And then open the airway again and blow. 1.
And 2.
And 2. So you keep doing that. 30 chest compressions, 2 ventilations. 30 chest compressions, 2 ventilations. Until help arrives or until they start to breathe on their own.
Kuna mtu anakuoch saya anashanga, tulisema this is an 8-month or 9-month baby. Na intensity ya kufanya hivyo na vidole. Utakuwa muumiza chest?
Priority yako si kumuumiza chest. Priority yako ni to make sure that they are breathing. So while you're using 2 fingers, because utaona tukimove kwa the older child itakuwa 1 hand. And for an adult itakuwa 2 hands. Why using 2 fingers is because of the strength of the 2 fingers is adequate. The point is to do a compression iende 4 centimeters down. Yes. So hii vidole mbili ni 4 centimeters down. Zinaweza for an adult. Now even even children who are 10 years old can do this, and for them they'll probably need to do using 1 hand because of the kind of strength that is needed to compress. Unajua kifua ni ngumu hata kama ni mtoto mdogo. The kind of you need to push hard enough to ensure that blood is circulating. That's the whole idea.
So tumepiga 5 breaths
and then 30 compressions
of them, then tena tukarudi 2
and then 30 and then 2 utaendelea sasa hivyo until they start to breathe on their own or until help arrives. So nilitumana. So ambulance
ulinituma nikaita St. John Kamini.
So ambulance wakifika ama mkiamua sasa nyinyi ndo mtampeleka tu hosi nyinyi wenyewe, because sometimes it's much easier for them if you have a vehicle near you, peleka ye hosi. So as you continue, as if when umeamua kumpeleka hosi, unafaa kuwa unaendelea na compressions. Unaendelea na compressions kama unaenda as on your way to hospital.
So onjui ya vule, because now for this one tumeona mtu yako chini, let's say for example iko kwa either kwa bed ama kwa floor.
Yes.
So hypothetically mtu assume utaenda kwa floor or everything, but then now also umemshikilia. So what's the difference when for both locations, even at a position ya mwili venye iko? Hii mwili iko flat kwa mgongo and everything. For this one venye umemshikilia, even the position of the head changes. How different is it ukimpea the CPR?
Now, the ideal position for you to give chest compressions is on a firm surface, on a firm flat surface, while they're lying on their back. that is the ideal position, so that you can give an effective chest compression. Now, if you need to travel with your baby, that's when unamuinua unaenda naye, because they haven't stopped breathing. If they haven't started breathing, then you need to still manually circulate blood. Sasa, that is why unajaribu cover up for that. Sasa, but this position is not very ideal for giving chest compressions, because you won't probably achieve what you need. That is why we insist wekelee kwa firm surface, so that blood iweze kutembea.
Right. So, and even as we continue, remember, can always be part of this conversation. In case kuna maswali, 0795-045-864 0795-045-864. Tupigie simu na ulize Wanjohi hapa all those kind of questions that you have concerning, maybe kuna mtoi kwa nyumba unashanga by the way, na in case makosa ifanyike, what will I do? So tumeendelea na hiyo, so I'll follow up on that. Ni tumeendelea for example, we've done the first 5 breaths, kupiga 30 CPR, then tukiendelea, and then you notice something, maybe even the eyes, or something, some changes with the facial expressions, maybe some discoloration, kitu kama hiyo. Tell us about that.
First thing, when a baby is not breathing, you will notice the color on the lips. They'll start to turn a grayish, bluish color. Hiyo tunaitaga cyanosis. So if you notice that, then it means that blood is not circulating and oxygen is not circulating vizuri. So that is why you need to have started CPR immediately. That is an indicator. But ukiona sasa hiyo color ina change, inaanza kukua now the normal color of the baby, inamaanisha the compressions and the ventilations are working. And if they even start coughing, then you know that they have started to breathe on their own. So if they start breathing on their own, kama ni mtoi kama huyu, utamweka recovery position. Recovery position ni kuensure that airway ina maintain open. So utamshikilia tu hiyo.
Mshikilia. Bonione. Before ni pata.
Una support kichwa. Una support kichwa with the head lower than the rest of the body.
So hapo your design.
Your design. So make sure that kichwa pia airway inakuwa open kiasi. So in that position, the tongue doesn't block the airway. And if there's anything coming from the mouth, it can really drain out.
For how long?
Mpaka umfikisha hosi. Remember your casualty wasn't breathing. The casualty wasn't breathing.
Ambulance imekam nini ama tume.
So ambulance
ilichelewa tuka.
Kama ni ambulance imekam, hao watu ambulance sasa watasort. In a way that watampatia oxygen na vitu kama hizo. But kama ni wewe ndio ulikuwa unamfikisha hosi, utamweka hivyo mpaka afike hosi.
Sawa, wacha tushikilie Ashley hivi alafu tuende Meru. Nelly, habari asubuhi?
Nzuri sana.
Watu wa Meru mnaendeleaje?
Kwema.
Uko na swali ama uko na maoni?
Nimeturn on to TV, so I don't know whether kama halikuwa amekusia mambo na mtoto kama amko choked.
Okay. Amesema ameguzia hiyo,
Anataguzia.
Ningependa kujua the first aid ya mtoto kama amekuwa choked, mnasaidia aje?
Okay.
Sawa. Asante sana Nelly kutoka Meru. Nasikia hata background noise, kuna mtoto hapo. So wanafuatilia hii.
Yes. Yes. Now, ameuliza kuhusu mtoto mwenye amechoka. Ndio? Saidie mtu hiyo. Saidie Ashley. So, ukiona ana choke, again, uta notice the same things. Maybe a bit of coughing, alafu utaona ni kama ameturn pale, bluish. So, what you will do, utamshikilia hapa. And then you turn them. Sijui kama naweza squat hapa. Then you turn them like that. Unaona hapa hivi. Una make sure that the thigh is used as support. The head is lower than the rest of the body. So ile kitu utafanya, utampatia 5 blows hapa kwa mgongo tu. 1 2 3 4 5.
Intensity una kidogo hard.
Yes. Lazima ugonge na nguvu. Remember, choking is life threatening. So lazima ugonge na nguvu. Akilia unajua kwa sawa.
So inamaanisha airway imekuwa clear.
They are able to breathe. You know, someone who's not crying, they are not able to breathe. So umegonga mara ngapi? Mara 5. Unaangalia mdomo. Kama iko kwa mdomo unaweza ivuta, but kama usiende kuitafuta.
Kama iko tu hapo karibu
kama iko tu hapo karibu unaweza toa na kidole yako ndogo. Lakini kama huwezi ona and they are still choking, you will turn them.
So for the first one we are done 5.
Yes.
But then 5 no response. So
ndo unamgeuza.
Okay.
Unamgeuza hivi. Unamshikilia kichwa. Umeshikilia kichwa, the head is still lower than the rest of the body, still supported by the thigh. Hata unaweza keti chini mahali. Unaona zile vidole mbili nimetumia za CPR. Hapa. 1 2 3 4 5. 5 times chest thrusts. Unafinyana tu nguvu. And then turn. Angalia. Akianza kulia, good sign. If not yet,
go back to it. Haya. Kaa hapo hivyo tuende Kericho sasa.
Sawa.
John, habari asubuhi?
Mzuri sana.
Watu wa Kericho, I hope mko salama?
Tuko salama sana.
Uko na swali, uko na maoni unataka kuturushia?
Niko na maswali. Nasema sasa wakati mwingine unaweza kuta mtoto faint ama wakati ulikuwa umeweka jiko kwa nyumba, yani ulikuwa umeweka jiko alafu mtoto faint, apate kufaint kama maana kama hakuna dalili, hata unasikia mtaka kufanya nini,
hakuna dalili
hiyo dalili ya kufaint. Unajua wakati mwingine nimeona
okay,
tunapoongea naye unapata kama unapomuona unaona ni kana kwamba hakuna dalili, anaanza kulia ama anakuambia anataka kuenda haja kubwa, anataka kuenda kutapika au kujoa. So unakuta wakati mwingine ukimtoa nje unakuta hiyo hiyo baridi, yani akipigwa na hiyo baridi ndiye anaanza kurudi at least. So ni nini hapo inatakikana afanywe wakati anafanya kitu kama hiyo imempata?
Sawa. Wanjohi hapa kwa studio amepata your questions, atakuwa na kujibu. Asante sana John kwa kutupigia. Salimia tu Kericho.
Asante.
Oh yes, remember back at home or wherever you're watching us from, you can always be part of this conversation. Tupigie simu, namba iko hapo chini 0795045864. Na uulize maswali ama in case you have your own tips na uko na hii by the way ndio inawaka. Wanjohi hapa anatuambia 5 lakini mimi nilijaribu 4 ikawaka. Maybe tuambie tips zako. But then
si lazima umalize 5. Hata unaweza fanya 2 work.
Lakini
una stop.
Oh yes. You can answer what he's talking about before we continue. Unaweza nipatie nishikiliange Ashley.
Sawa. He's talking about fainting. Ile kitu ameongea about ni dizziness, anasikia joto na nini, akimtoa nje ndo upepo inamgonga ndio anarudi normal. That's actually very okay. Iko sawa. Usually mtu anataka kufaint kwa sababu ya maybe hajakula ama akona stress. Sijui mtu yeye anakuwa na stress gani, but akona stress. And then even very sharp pain. Kama ushaigongwa na dirisha kwa kichwa.
Ama wache hiyo ile ulipiga mguu kwa meza ama sofa pale chini.
That kind of pain can cause someone to faint.
Ushaifinywa kidole kwa hinji ya mlango.
Exactly. Ndio hiyo sasa. So when someone is feeling faint ama akifaint to akicollapse, what we want to do is ensure that blood circulates to the brain, because ni temporary reduction of blood to the brain. So ile kitu tunataka ni loosen clothing, give them air, and unaweza inua mguu kama unaweza inua mguu and just observe them. If they are unconscious for more than 10 minutes, then hiyo sasa ndio wasiwasi nafaa kuingia, but on its own fainting is not a big deal. Akiregain consciousness most of the time ni njaa. Kama ni njaa mpatie kitu iko na sukari akunywe, alafu mpatie sasa chakula vizuri.
Alright. Before tuachane na Ashley tungekuwa Jonte.
Yes.
Let's say for example Ashley mwenye alikuwa namtekea alikuwa napika kagitheri nini, wakaweka jiko hapo ndani, ni bed sitter tu ama single room. Akatoka masaa asubuhi nini, so alifunga madirisha ndio Ashley asisikie baridi. Akaenda kutafuta manyanya, vitunguu, hizo spices zote ndio rudi. Aliacha Ashley akinini. Lakini sasa hiyo moshi ya nini anarudi apata Ashley kidogo hasikii, anajaribu kumwita Ashley, amka. baby galamka aski.
Not breathing.
What happens in that case? Do you still do the whole CPR because now let's say moshi imejaa kwa nyumba hiyo time?
So the first thing is to get them away from the danger.
Yeah.
So hapo moshi ndio danger. Kwanza mtoe kwa hiyo danger yote. And then peleke to a properly ventilated, hata huko tu outdoors, properly ventilated area. Mweke, observe, fanya tu your RABC, response airway breathing, circulate. If they're not breathing, start CPR. If they are breathing, weka recovery position.
Okay. Haya. Acha tuchukue simu nyingine kutoka Kitale. Habari asubuhi.
Nzuri sana.
Asante sana kwa kutupigia. Uko na swali, uko na maoni?
Mimi naitwa Catherine Boyd, natoka Kitale. So nilikuwa nataka kuulizia about kama mtoto amedrown. Sometimes so tunaacha hizi babies za maji nje. Na tunapata most of the people wanadrown, hata wengi wao wanakufa. So the first aid there. Alafu pia I wanted to know those children when you may ingest poison, for example paraffin. What is the first aid there?
So asante sana Catherine, usalimia watu wa Kitale.
Okay.
Waambie endelee kuwatch some quite interesting questions hapo hivyo tukiendelea. So maneno ya Ashley tumemalizana na hiyo bit ya moshi and everything.
Yes.
So we can get into the whole drowning because najua pia it affect pia Jonte.
Yeah.
So I'd want to get sentiment here, drowning for different kind of ages as well.
Okay. Drowning is just managed the same way. Again, we insist danger, response, airway, breathing, circulation. The danger here is the water. If it is drowning, kama ni mtoto mdogo kama huyo ameingia kwa besheni they have stopped breathing, someone wasn't watching them and they have stopped breathing. So the point is first to get them away from the water. Mtoe, alafu any wet clothing that they have on or kama ana they are still wet, try and dry them. Because the water is what is the danger. Because there is something we call hypothermia, when body temperature inashuka chini. So ikishuka chini below 35 degrees, it is dangerous. So tunataka kwanza to dry them so that they maintain warmth. And then check, are they breathing? If they're not breathing, start CPR. Sequence of CPR is the same, be it drowning, be it smoke inhalation, be it is the same. So you just do the CPR sequence. If they are breathing, recovery position, peleka EHOC. For babies below 1 year old, any injury, please take them to hospital.
And mostly for drowning, there's something that is commonly done.
Yes.
Mtu anafinya hapa kwa mapua, alafu ile the whole mouth to mouth resuscitation.
Yes.
Will you advise for that?
Now, if you're doing mouth to mouth, hiyo ni kawaida. Maybe I should answer that using
okay, so.
Now, when if it is a drowning victim, of course tumesema unatoa hizi nguo zote wet na nini unamdry. Then you open the airway. When you're giving mouth to mouth, you're actually supposed to pinch the nose for a child who is above 1 year. For an infant who is below 1 year, your mouth should be able to cover both their nose and their mouth. Because unataka hiyo hewa iingie ndani ya lungs. Sawa. But for a child, you will need to pinch their nose so that you want to blow air into their lungs. So when you blow air into the lungs, kama kuna maji, you're trying to displace it, itatoka tu yenyewe. They will cough it out. When they are coughing it out, that's a good sign. You turn them on their side so that it can happen that way. So this is my chat ongea na Jonte hapa.
Ongea na Jonte.
Hello, can you hear me? Jonte, unanisikia? Open the airway. Check breathing. They are not breathing. I send for help. And then I start. Tulisema tunaanza na breath. You pinch the nose here now and then you blow. 1, 2, 3, 4, 5. Now, sometimes if it is umemtoa tu kwa maji saa hiyo tu, just at that moment, you can even blow once and they start coughing. If they start coughing, just turn them onto their side so that the water can drain out. Once you do that, ukiona ameacha, then you can turn them to do a more thorough check. Once you do that, then now you place them in what we call the recovery position.
Right.
A recovery position is just to lie on your side.
Okay. So far Njuhi tumepata callers and who are either parents or guardians. Anauliza mtoto wangu akikuwa hivi na hivi na hivi. But then now let me ask on behalf of children, because sahi most kids are in school. And let's say Kamata ni boarding. Tulikuwa na the whole hypothetically drowning. So you'd find, let's say ni shule yenyewe wako na swimming pool, ama zenye sisi tulienda swimming pool ni ile base tu mahali how that gets into it. But then before that let's hear from Victor kutoka hapa hivi tu Nairobi. Victor, habari asubuhi.
Mzuri sana.
Asante sana kwa kutupigia. Uko na swali ama uko na maoni unataka kutuambia?
Ni swali. Sasa niko nauliza. Mtoto alizaliwa lakini hakulianga, venye mtoto anazaliwa huwa analia. Hakulia. Sasa niko nauliza kuna effect?
Okay.
Mtoto alizaliwa na hakulia. Okay. Very many things could have caused that. So hiyo ni kitu kwa hosi ndio wanafaa kumweleza ni nini ilifanyika. So I can't really effectively efficiently answer that
and pinpoint
what the problem is. So hapo kwa hosi ndio dokia anafaa kumwambia hii ndio ilikuwa shida ama hii ndio ilikuwa shida, that's why hakulia. Sometimes ilikuwa tu maybe umbilical cord ilikuwa imemchoke. It happens, there are various things that happen.
Oh yes. Back at home ama wherever you're watching us from, tupigie simu 0795-045-864. We're discussing matters first aid when it comes to young children. An accident has happened, but you as a parent or a guardian, do you know what's the first step when it comes to first aid that you need to do? Do you call in live and throw in all those questions? So to look at the whole bit of drowning, and my question was, so because for example, they are the caretaker, but now can a child give first aid to another child? Let's say ni pale boarding, hakuna a caretaker around, there's no adult to actually come and, let's say, give this first aid. But can a child actually give, let's say ni Junti hapa, tulisema about 7 years. Yes, so 7 years ako mali, sa ini grade 1, and everything, wanacheza makosa ifanyike.
Now, yes, wacha tujibu kwanza swali, can a child give first aid? Yes, they can. And what we insist on is a big part of their first aid training, because we do have even St. John units that we call dolphins in various primary schools around that we train them in first aid. What we insist on is the ability to make a phone call.
As the first priority, ama? As
the first priority. The ability to make a phone call so that they can get someone who can come and give much more assistance. So if it is calling a parent, calling a guardian, or even calling the ambulance, that ability to make a phone call and give the right information, that's the first thing that we insist upon.
But realistically speaking, so zingine uzipata your chance, even for this child, izipata chance ya make that call. So, for them they're thinking, my first priority ni wacha kwanza ni make sure nimetoa my my fellow child kwa hii danger yenye yako, or something like that.
Yes. Again, tumesema hiyo ni priority, that's just steps. It's just steps. If you're able to make a phone call and you have access to a phone, please make the phone. Again, what you're saying is get them away from the danger. Yes, the child can actually get them away from the danger if it is drowning, but if it was in a pool, vile umeniambia, even for adults, we don't advocate for you actually going into the pool. Even if unless you're properly trained in water rescue and such things. The first priority is always to maybe throw something like a rope so that person can grab a hold of that. Ndo umvute kutoka kwa maji. Kama ni kijiti uko nayo, reach out with a stick, mvute kutoka kwa maji. Wacha last option ikuwe ndio kuingia kwa maji. And for children, yeye asiingie kwa maji kwenda kutafuta mwenzake.
What's the danger of I as an adult? Niingie ndani, let's say kwa dofu mpararo, niingie ndani, nianze ku...
For an adult, first of all, you need to be adequately trained. You need to be a very good swimmer. Otherwise, mtadrown nyinyi wote. The thing about water is that you have to take care of yourself first, because hakuna mali unakanyaga farm.
True.
So you need to be very good. You need to be a very good swimmer. And once you do that, and once that happens, for an adult taking care of a child from a pool, hiyo si kitu kubwa, because unaweza subdue mto hivi virahisi. But if they are taking care of a fellow adult, unajua an adult anaweza mshikilia kwa shingo, amshike ngeta na mwingie nyinyi wote kwa maji. So hiyo ndio kitu yenye tunajaribu ku discourage sana. If you see them they are still kicking, wacha kwanza atulia choke, and then sasa umtoe if you have to actually go into the water. But for an adult getting a child, you can just do it immediately, because mtoi ni mdogo na wewe ni mkubwa, and you're able to subdue them virahisi.
Right.
But make sure you're a good swimmer first of all. That's the first thing. And of course a bit of training in water rescue techniques and such.
Okay.
Yeah.
So back to your training ya watoi you're having even for the dolphins, as you say.
Yes.
So what do you specifically train them? And because let's say kesi ya John Tepa, so he's about 7 or 8 years old, ni training gani unampatia ndio pia saidie Brayo next time?
Tunampatia tu the same training yenye nimekuwa nikisema. It's just that tunajaribu kuirahisisha. Make sure that the scene is safe, check for dangers, make sure that your friend is responding to you, talk to them, ask them questions and such things. Make sure that airway is clear, breathing is present. Those are always your priorities. We also train them how to ensure that they are breathing and such, and also manage choking, because again, choking is also something that is life-threatening. So it's a good idea to help them understand how to check on a casualty who is choking and to assist. And then beyond that, now we also train them on managing minor wounds and tying dressings and bandages and slings and such.
Right.
Yeah.
So now, right, let's get from James Mwangi from Nakuru. Jimo, habari asubuhi?
Salamu sana.
Unaweza tuuliza hizo maswali ama maone yenye uko nayo, unaweza paza sauti kidogo ndio tukusikie.
Sasa nilikuwa na swali ya mtoto amesweta, alikuwa amelala na kidogo hivi, maybe ilikuwa kitu kama mchana kama saa 7 hivi. Alafu
yes, endelea.
Hello.
Na tunakusikia, endelea.
Mtoto alikuwa amemwacha akalala, sasa ukamwacha hadi amejifunika, so kirudi unapata mtoto amesweat all over, kila mahali akona maji. Sasa unashindwa itakuwa namna gani? So hapo kidogo unaweza kumuita,
endelea.
Unaona alipiki, haongei, amekaa tu. Sasa unaweza msaidia aje? Sasa hapo tuseme pengine ni maybe hewa alikuwa amekosa. Unaweza msaidia aje?
Yes. So asante sana Jimo. Acha ujibiwe na kiongozi hapa.
So amesema amepata mtoto amelala na anajaribu kuongelesha, aongei. So unataka kujua ni nini inaweza kuwa imefanyika.
Pia amesweat.
Amesweat and such. Again, when you're doing first aid, tuna insist to are they responding? Is their airway clear? Kama hapumui, tunafanya hivyo vile tu tumefanya drowning. Sasa, but kama anapumua, you turn them on to the recovery position. Now, if they're sweating and such, it could be because of fever. So, tunaangalia tu kama kuna fever. The temperature is warm or hot. What you would do in such a scenario is get rid of extra clothing that they don't require. Unatoa tu hizo nguo extra zenye amevaa, unamwacha na basics kama ni mtoi mdogo. Alafu because fever inakuwaga problem ya inaweza cause seizures in children. So seizures ni sasa hizo kama za kifafa na nini. You need to keep them safe. So kama ni hiyo ya kifafa, kuna ile kitu watu wanasema ati unamshikilia ama unaweka kitu kwa mdomo, please don't do that.
And actually now ndio so that ni part of final thoughts zako, because I'm pretty sure the parents who have children with cerebral palsy.
Yes.
And pia watataka kujua, am I going to do the same kind of a first aid for my child who has cerebral palsy compared to na mwingine tu mwenye they're okay?
What we say is that you're managing a particular condition when it happens. So if it is cerebral palsy and they are prone to getting a seizure, you're managing the seizure, you're not managing the medical condition that is managed by a doctor. And advice on medication and such things. When they get the seizure, that's when you need to act. So if they get a seizure, what you need to do is keep them safe. Keep them safe, head supported, something soft under the head, and ensure that clothing is loose and you do not, you do not restrain them. Wacha tu mpaka seizure iishe. So if it lasts for too long, over 5 minutes, then the seizure becomes dangerous because they can stop breathing.
Yeah.
So in such a scenario, you need to get them to hospital as a matter of urgency, because when they're having a seizure, there's really not much you can do.
All right.
So, but when the seizure ends, check if there are any injuries, but management is similar. Yes.
Aye. Your time is to put your final thoughts, maybe advice kwa watu.
When it comes to first aid, tunasemaga tujaribu kupunguza kienyeji sana, because you heard someone say something to someone. So just keep it simple, call for help. Our numbers, I can actually give you St. John ambulance numbers. St. John ambulance number is 0721 225 285. 0721 225 285. If you call that emergency number, there is someone on the line there who is trained, who's a trained emergency medical technician. They can give you advice, first aid advice, while on the phone. But if you're alone and maybe you're unable to make a phone call, just keep it simple.
Unaweza rudia number slowly.
The number is 0721 225 285. 0721 225 285. That is our 24-hour emergency number. There's someone always answering that phone. If you need an ambulance, call that number. Ambulance will be dispatched to you.
Right.
Countrywide.
So. Andrew, nimeshukuru sana. First aid trainer from St. John Ambulance. Tukiwa hapa hivi na Junti na Ashley. Leo ulisema nikuwe baba Ashley.
Yes.
Naona nimemshikilia vizuri all that time. Oh yes. Back at home, I hope you've got the answers that you're looking for. Kama bado una feel hapana, you can always reach out to St. John Ambulance na pia wakusaidie on the socials, and pia uweze kusaidia